Hello all. Okay, I think we'll get started. We've got a fair number of you in the room. So welcome back. This webinar really is just about looking at your COVID-19 toolbox. So looking at a number of sort of options that we've got available. So just to introduce myself to start with, I'm Alex. You may well have been on one of my webinars previously. I trained quite a long time ago now at the Guildford School of Acting and have worked in this industry of dance and drama now for over 20 years. I look after a number of the large shows that take place around the UK and internationally. So for many of you, things like Move, etc., that take place at Excel, you'll be familiar with. I'm NEBOSH qualified and hold several other qualifications in health and safety, and also a member of the Institute of Risk and Safety Management and of Occupational Safety and Health. I'm joined today by three people that you can see on your panelist sort of video. So I've got Adrian G. Turner from Nemesis EH2O, and Lee and Paul, both from Camphil. So they will introduce themselves respectively as we get to their parts of the presentation and tell you a little bit more about themselves and the companies they sort of represent. So in terms of what we're looking at today, this is kind of the agenda. So we're going to look at how COVID-19 is transmitted, the objective of today really, so looking at our obligations under the Health and Safety at Work Act, how we use the hierarchy of control and why we're looking at engineering controls, and then really giving you some sort of tips in terms of balancing cost and time versus kind of the benefits in terms of risk, and for some of you also increasing numbers, etc., in your studios. Then we're going to have a look at Zuno, and sadly James from Zuno couldn't join us today, so I'll just be sort of hosting that part. Then Adrian will take us through sort of choosing a disinfectant and looking at spray and fogging options, and then Lee and Paul between them will be looking at air sort of solutions and kind of the benefits of fresh air versus air purification, etc. And then most importantly, at the end really is a bit of a Q&A where you can send questions via the Q&A module. So just before I get going, just a few sort of little bits of housekeeping. You can obviously see us, but we can't see you. And therefore, as we approach the Q&A session at the end, we will use the Q&A module that you should have access to on the bottom bar of Zoom. If I could ask you please just to keep any sort of questions until nearer the end of the presentation. It may well be that one of us covers them throughout. If we don't, then by all means pop that question in and we'll do our best to answer it at the end. And also just to let you know that this session is being recorded and will be made available sort of post-webinar. So if you do miss anything or want to go back on it, then you're more than welcome. So a question I get asked a lot is this: I don't need this 15 minutes that you kind of recommend to clean between my classes. Would 5 minutes be okay? Now, I think a lot of perception when we kind of recommend this is that we think the 15 minutes is just for cleaning our space. And it's not. There's a number of reasons we recommend the 15 minutes. One is to clean all your sort of touch points, etc. And that's something that Adrian will sort of be looking at in terms of minimizing the amount maybe of cleaning you need to do of touch points, etc. You know, and sort of other solutions in terms of cleaning. But also it's about rotating your classes. So you don't want the class that's leaving meeting the class that's arriving. So we want to try and separate these parties. So 15-minute kind of window does that. And then really quite importantly at the end also is it's 15 minutes to air your space. So we've had a number of dancers jumping away for sort of probably 45 minutes, almost an hour within a space. They've built up what we call a cumulative sort of aerosol. And really we want to disseminate that and try and air that space. And there's a number of ways we can do that, and that'll be something that Lee and Paul are kind of looking at as we go through this presentation. What I thought would be handy to start with is just looking at how COVID-19 is transmitted really, and there's three sort of primary routes. One is the respiratory sort of droplets, one is the contact sort of route, and then the third, and still being researched, is this kind of cumulative aerosol effect, so the fact that it hangs around in the air. So if we look at those three in a little bit more detail. So the contact transmission is probably reasonably common sense. So that's where viral particles emitted from our sort of respiratory tract, either through us coughing, sneezing, etc., land on a surface or indeed our hands, etc. And by touching another person or that person touching an object and then touching their own nose, mouth or eyes, they are transferring those kind of viral particles from one surface to another. The next one is the respiratory transmission, and you will all be well aware of the government's tagline, catch it, bin it, kill it, that's been running throughout sort of the COVID campaign, and sort of sneezing into elbows, etc. And this is all to try and reduce this respiratory transmission. So this is from one individual to another who's kind of within their immediate vicinity. Again, often through coughing, sneezing, etc. But it can also just be through verbal communication, singing, etc. that kind of comes to light in our kind of areas and our industries, I guess. And then the last one is this aerosol transmission, which is still coming to light. So some of you have been aware that there was quite a bit of research going on around singing, shall we say, within the dance and drama industry. And the government for quite some time felt that singing was an enhanced risk. So anyone who was kind of pushing their voice, etc., was providing an enhanced risk. They've done a huge amount of scientific research and ultimately came back several weeks ago and updated the performing arts guidance to say, actually, we don't believe that singing does give kind of any enhanced risk. It's no different really to having a verbal conversation with someone. And we feel that the 2 meter plus rule and maybe other mitigation would be appropriate to manage singing. However, on the back of that, they have come out with this cumulative aerosol transmission, and they've got more concern for the fact that a number of people in a space, and so this is spaces like theatres, football stadiums, etc., where people are chanting, singing and engaging, are adding to this cumulative aerosol that appears within a room. So that comes back to my point earlier in terms of airing your space, but we've also got to think about where that cumulative aerosol is resting or is settling. So it will generally sit in the air, and depends on particle size for a short amount of time, through to, it could be up to 3 hours, some of the research suggests. And where is that kind of ending up? Where is that settling? And that's where we're looking at solutions in terms of air and cleaning our air, but also in terms of fogging, etc., in terms of cleaning that space before our next group sort of come into there. So that's something we've got to be a little bit conscious of at the moment. From that, just to clarify a couple of bits from the Health and Safety Work Act. Those that have been on my webinars before will have been through a number of these slides. I've only picked a couple out, but that really is that as employers and as business owners, we are responsible as far as reasonably practical to provide this space that is safe and without risks to health. And I do want you to remember those words, so far as reasonably practical. We're never going to achieve everything. And we'll look at that as we go through the presentation, but we need to put mitigation in place that is reasonably practical. And we need to look at things like time and money as much as impact, and ultimately produce this space that is as safe as we can get it and without risk to health. And obviously with COVID around at the moment, that's really kind of key. And that also applies to our venues as well. So they have a similar responsibility as a venue to provide you with a premises that again is safe and without risks to health. So some of you on this webinar may well be from venues rather than sort of from hirers, etc., going in. And therefore, some of these solutions you may find are applicable to you in terms of turning your venue round possibly slightly quicker than you have done previously, or increasing your sort of cleaning regime in order to provide your next hirer with a safe and healthy space. So how do we do this? Well, we have in risk management, my world, what we call the hierarchy of control. So ultimately, this is a triangle. We start at the top and then we work our way down the triangle doing as much as we can. So in the terms of COVID-19, elimination sadly isn't really an option. COVID-19 is around and we've got to deal with the fact that it is around. Likewise, substitution. It would be great if we could substitute COVID-19 for maybe something less virile, but we can't. So ultimately, those two are out of the equation. So the next most important thing really in this hierarchy of control is engineering controls. And that's what today's webinar is really kind of focused on. So these are all the things we can put in place from what they term an engineering perspective to kind of reduce the risk. So that's things like cleaning products, that's things like opening the doors and windows, looking at air purification, looking at people all washing their hands and singing happy birthday for sort of 20 seconds. All of these things are vitally sort of important, and what sort of soaps, etc., we kind of provide for them to do that. After that, we've then got what we call the administrative controls, and that's around behaviour management. So I'm sure you're all well aware that on Monday in England, specifically, the law changes, and it comes in rather than guidance, it's now in law that we can't have gatherings of over 6 people in social environments. So just to be clear to anyone who's on the call, that doesn't impact businesses, education environments at the moment. You continue to work to your risk assessments and everything else in terms of capacities, but it does impact the social side of things. So gatherings in houses, outside, pubs, etc., and keeping those groups separate. And this is all administrative control. So it's about behaviour management. It's about trying to change the behavior of individuals in order to effectively prevent or reduce the risk of transmission. And then right at the bottom of this triangle is PPE. And in risk management, PPE is always the last kind of resort, because ultimately the others tend to have a far greater impact than if we put people in masks. Masks are great and face coverings are great, and they have a certain amount of benefit, but there's also a lot of cons that come with them in terms of how people handle masks, particularly for younger children, if they're not putting them on and off properly, if they're not the right type of face covering, etc. And therefore PPE, there's a huge amount of variables in how we sort of use it. Whereas engineering controls and administrative controls are something that we put in place as a business, and we have far more control then over that space and the kind of safety of that space. So that's what we're going to focus on today, the engineering controls. And how are we going to do it? Or, what have we got to bear in mind? Well, ultimately, everyone on this webinar runs a business, and you've probably spent many years building your business up, building up your reputation, etc. So we need to balance your time that you're going to spend putting these things in place versus how much they cost for you to put in place, and ultimately what you're going to get out of them. So in here it says performance, but ultimately benefit in terms of risk, and from your perspective, increasing your reputation, etc., within your community, possibly increasing the number of dancers that you can have in your space. So when we look at air purification, we'll look at how much that kind of benefits kind of your capacity, for example. And you may well find by having 3 or 4 extra children in the class offsets the cost of an air purifier for start. You may well find that actually that paying that cleaner for 2 hours extra each day to clean your studios is offset by using a fogger that only takes you 2 or 3 minutes to clean a studio. So a lot of this is about scales and balance, and looking at how possibly investment in one thing can offset something else. But at the end of the day, we've all got that bottom line to keep an eye on, regardless of what business we're in. And it's about looking at that bottom line and maximizing that sort of bottom line and balancing out what we can use. So I've just sort of mentioned it in terms of air management. Most of you will have been onto the sort of capacity calculator on our website that comes as part of your risk assessment. And there's this funny little drop down at the top that asks what kind of air you have in your space. So whether literally it's a sealed space, no windows and doors, whether you can open doors and windows and sort of get some fresh air through, or whether you happen to be lucky enough to work in a leisure centre or something similar where they have fresh air handling and they change that air sort of 10 to 12 times an hour. One thing we need to be conscious of as we move forward with all of this is that winter is approaching. So whilst the government are very key that we need to open doors and windows, that's great until we start creeping into November and December, where actually having the doors, windows open and sort of a 3, 4, possibly a -degree breeze blowing into our dance studio will have other impacts on things like muscles and so on. And so again, when we look at air purification, we're looking at ahead, I guess, in the game. We're looking 2, 3 months ahead from now, when actually maybe some of the mitigation we've got in place now isn't going to be suitable as we sort of move forward. On my slides in previous webinars, you will often have seen these sort of photos, and this is kind of what today is all about, really. So I've always finished any previous sort of webinar just summing up some of the technology that is out there and is available to us. The one top left is a thing called Zuno that's been around for quite a while, but has suddenly ballooned in popularity, and I'll have a look at that. We've then got air purification sort of units, and that's something that Paul and Lee are going to sort of talk us through. And then on the right hand side, we've got fogging options, and there's a couple that I've always had on my slide. There's a company that produce effectively a fluid that goes in a theatre smoke machine to utilize technology we've already kind of got, which is great, but you can see on it the hazard sort of symbol on the front of that pink sort of container. And therefore, to use that kind of disinfectant, I guess we call it, also comes with sort of PPE and cost sort of risks as well. And then we've got this one at the bottom, which is Nemesis EH2O, which is something Adrian's going to sort of fill us in on and talk through the benefits of fogging and sort of focused contact point sort of cleaning over just sort of generalized cleaning that we do sort of day to day. So that's kind of my element out the way. Now, as I say, James from Zuno sadly can't join us, so I'm just going to take you through the Zuno elements in terms of an understanding of what Zuno is. But this first slide, and this comes off their website, I think is one that we need to bear in mind. You know, we've been told bleach and everything else kills COVID-19, which is great, and it does. But like all liquid disinfectants, it's only really effective at the time of use. So when we wipe a surface down while it's wet, etc., yes, it's killing off those pathogens that are kind of on those surfaces. But as it dries out, ultimately it's leaving that surface then to be recontaminated, etc., and for those pathogens to once again sort of settle. And that could happen within minutes if someone passes and has a cough, through to sort of several hours. So this is where Zuno have kind of come up with a product that is part of our cleaning regime. So none of these things we're mentioning today should be taken sort of on their own necessarily and are kind of what I would call the silver bullet. They're all part of a cleaning regime or a management routine, and it's a case of balancing up which ones you may or may not use to sort of best fit your studio. But ultimately, Zuno leaves behind a monomolecular layer that sort of bonds to any surface. Now, these are generally hard surfaces. And ultimately, all that does is as positively charged microscopic pins that attract and pierce these pathogens that sort of land. So in terms of us touching things like toilet pushes, door handles, etc., all it's doing is helping to reduce the cleaning regime of those points of contact. So they themselves don't say, as you can see at the bottom of this slide, that it's going to completely eliminate cleaning. That is not the case. Your normal cleaning regime should continue. All this is doing is helping to reduce the amount of pathogens, etc., that bonds to a certain surface, and therefore reduce the chances of kind of contact in terms of someone else touching that surface and picking it up. So it's fantastic for certain bits, and that's things like door handles, toilet pushes, ballet bars, all these kind of contact points, but it is not a silver bullet in terms of fogging a room and going, that's great, we'll come back in 2 weeks' time and all will be fine. That's not how Zuno sort of works. So sort of summing that up, Zuno is not a silver bullet. Nothing is really. Everything that we do at the moment, sort of fight COVID-19, is a case of having various sort of things and bringing them together to best fit our situation. So it is a tool within our kind of COVID armory. And we need to put a number of tools in that armory in order to be effective. It is not effective in soft furnishings. So I work in the film world, and the number of film sets that I've gone on to, and the producer says to me, don't worry, we're going to spray everything with Zuno and it'll all be fine. And I'm like, what, even the sofas, etc., that your actors are sitting on? Yeah, it'll all be fine. It won't be. James at Zuno himself will tell you that Zuno is not effective on things like soft furnishings. It's great on those hard contact surfaces, but it is not great on sort of soft furnishings. So we need to look at maybe fogging things like sofas, etc., in order to treat them sort of between shoots or between classes and so on. And that's where kind of fogging comes into its own. And Zuno, some of you may have heard, had made this claim that it lasts for 30 days. It's recently come to light that's not the case, and we've known that, or I've known that for sort of quite a while, but actually it kind of starts to really drop off after about 14 days. So if we're using Zuno, it's something we want to be reapplying, particularly on those sort of frequently contact points, at least every 14 days. And remember, it's just part of our sort of toolbox. So that's kind of all of my elements. So I'm going to hand over to Adrian, who comes from Nemesis EH2O, and he's going to take you through his slides, if that's right. Over to you, Adrian.
Thank you, Alex. Really good introduction, and thank you for setting the scene. As all of us are trying to decide, like Alex said, what we can do to try and reduce the risk, there's a number of things that our company, Nemesis EH2O, have done to approach this situation. So disinfectants in general, as Alex said, is very well known that the likes of bleach and other disinfectants are out there are effective against killing COVID. However, they're also pretty toxic. And if you're going to put something into a room that's pretty toxic, you then got to hang around waiting until that toxicity has been removed. So a product that isn't toxic would be preferential. So if you look at the market today and consider what you can do in the way of disinfections to kill off your risk, diminish the risk, but not make it so toxic and dangerous that you can't go in there yourself. So I could have the first slide, please, Alex. Whoops. So COVID in itself, It's of a family group that you've probably read in the press. There's a standard that is for SARS-CoV-2, which is as similar as the COVID that we have now. Unfortunately, because of the very nature of the way that this pandemic has had such a fast onset, and no one has really had the chance to do proper clinical evaluations or proper testing of the actual virus itself. There have been some studies, but those have all been done in the US and in the UK. There was one study done by Porton Down, but that hasn't been released yet, as I understand that some of the manufacturers that took part in that study, as well as ourselves, don't want the results to be released. But what you need to be able to do is that you need to have something that kills viruses, funguses, spores, the lot. So you get rid of the smells, you get rid of the pathogens that are challenging you, because like Alex was discussing in that risk assessment inverted pyramid, the whole business of transmission of any contagious disease is the pathogen multiplied by the active number of viable pathogens divided by the immunity of the host. Well, at the moment, we can't do anything about the immunity of the host. That's just what we have genetically. We can't do anything about the pathogen itself. It is what it is. But we can do something about the numbers of viable pathogens that there are in the environment. And that's what both disinfection, filtration, changing the air, and all of these other approaches, because it is related to bioload as to whether you will contract this disease or not. And that's been demonstrated through a number of different papers that are out there and experience in hospital environments. The greater your exposure to COVID, the greater your chance of contracting it, and that makes perfect sense. So you want something ideally that is going to be able to deal with all kinds of surfaces, conditions, soft, hard, slippery, rough, any kind of surface is really what you're looking for. But like I said before, but you don't want to be using something like a concentrate, bleach or acid that is dangerous to you or harmful to you. So in your search for something of that nature, you need to keep looking until you find something that really fits in with your business and for you to be able to continue operating. There would be no point in dealing with one threat only to generate another. Next slide, please. So while you're going through that process, you also need to be very careful about the product that you're choosing, because while there were products, and many of them that were around before COVID arrived, a lot of products have come onto the market during the COVID period, and not all of them stack up to scrutiny. There's a number of different products that claim any number of different things, and you've got to go into your local pub or supermarket or whatever, and the shelves are packed full of anti-bac, this, that, and the other, wipes or sprays, etc. But anti-bac is going to do nothing for you when it's a virus that you're trying to deal with. So take a check and have a look at the label as to what actual standards the product you're looking at meets. And you want to be particularly focusing on EN 14476, because that is the standard for the SARS-CoV-2 from the previous SARS pandemic, which is the same group of pathogens as the COVID. You also want to be checking that it's an approved product that you've picked up off the shelf. And when I say approved, I don't just mean something that's approved for use for pouring into the toilet or for spraying in the bathroom. You want to make sure it's approved for human hygiene. And to be approved for human hygiene, it needs to have met the ECHN BPR regulations, of which there are 5 parts, and part 1 is human hygiene. But not as in human hygiene, part 2 is for disinfectants and antimicrobial, antibiocides, which are allowed to be and authorized to be used in public places and private environments. And then if you're also concerned about using such a disinfectant in a area where you prepare food, you might want to check that the disinfectant you've chosen is safe to use on food and in food preparation areas, because many of them you'll read on the label that they're toxic to the environment and they're toxic to be used in areas of food preparation. Next slide, please. So while you're going about disinfecting and killing off everything in sight in your dance studio to make sure that your customers are going to be safe, you also want to make sure that you're going to be safe administering it. So if possible, you want to see if you can find something that you're going to use that isn't going to be harmful or toxic to you or your customers. Something potentially that you can administer without having to done up in huge amounts of PPE and goggles and eye protection and gloves and Wellington boots and hazmat suits and all the rest of it. And ideally, if you can find something that is also approved as a skin and antiseptic that isn't going to dry out your hands, something that, unlike alcohol, isn't going to start to make your hands crack after an extended amount of use, and something that's basically user-friendly, then you're doing well. Next slide, please. So it is also possible to find products that not only you can spray on all of your hot spots like door handles, string pull cords in the bathroom, all the places where you see and those high clean area spots generally that a lot of people touch. If you can also fog the same material to clean all of the nooks and crannies and reach to the different parts in a fast and effective way, to kill all types of bugs and beasties that hide from sight, but are the pathogens that you're trying to reach, then that would ideally be a great target and a good opportunity to take advantage of that capability. So to put it simply, you also want something, like was mentioned in the Zuno presentation, something that has a fast and effective onset. Regarding the longevity of how long you can kill off the bugs and beasties for, you want something that has a quick rate of action, and you want something that that you can go back into the room straight away, rather than having to have any downtime because you've got a business to run, and you need to do something that doesn't interrupt your business. Next slide, please. So I'm pleased to be able to tell you, which I'm sure will come as a surprise to you, that there is such a product available, and it's called hypochlorous acid. And hypochlorous acid, to give a very brief background, it is the same stuff that your white blood cells produce when your body is attacked by a pathogen. So when a macrophage, phagocyte in your lungs, finds a organism that it needs to attack, it'll surround it and then release hypochlorous acid to kill it. And this is why hypochlorous acid is lethal to pathogens, but it's perfectly inane to your body chemistry, because your body actually manufactures it itself. And hypochlorous acid in the brand of Nemesis EH2O is available in your local high street, and it's also available from us to the trade. Next slide, please. So you can fog and spray. You can spray and fog. So fogging to do your general background and to do your complete coverage. And then we would recommend spraying to do the hot spots that are touched by people on a regular basis. Because whatever product you lay down on an area in your door handles and finger plates and such like, as soon as you start touching them and having any high traffic, you're going to be removing whatever you've laid down. So we would recommend general coverage and then additional short-term intervention for your hotspots to reduce recontamination. Next slide, please. So fogging regularly, spraying regularly, it's a combination of the two. The fogging is very fast and gives you really good coverage. Spraying is a bit more laborious, but it's worth doing because of the very nature of we tend not to appreciate how much contamination occurs through our hands. And there's been a number of very nice videos looking at behavioral studies of how unconsciously people touch things. And I know certainly my 10-year-old son, doesn't matter how much I tell him when we go around the supermarket not to touch things, he continues to touch everything. But that's the nature of the way that we behave without noticing it. Next slide, please. So I'm going to show you in a moment a short video of the fogging in use in a dance studio. But we've been extraordinarily lucky that we were already in this market segment before the COVID issue arose, because we had already been in the hospital environment doing fogging and with HOCl, with Nemesis for quite some time. But actually the biggest demand we have had has probably been from community centers. And this is me down at my local church fogging the pulpit some weeks ago. Next slide, please. So the benefits of fogging is you get extremely fast distribution. Anybody can do it. There's no training required. There's no reach regulations. There's no COSH requirements with HOCl. There's no specific training. There's nothing you have to do. You don't have to don up in PPE. It's got a long history of being used, HOCl, in all kinds of different industry environments. I mean, the salad, for example, that will be imported from Africa by Marks and Spencer's is treated with HOCl before it comes. The fruit that comes from South America is treated with HOCl. We supply holiday homes, dentists, GP surgeries. The National Pharmacy Association has put out a note to all pharmacists that have taken part in the flu vaccine program to use Nemesis for fogging in between each patient being treated with their flu jab. And I've just had my flu jab notice come through for the 23rd, because I'm a type 1 diabetic myself. Yeah, so it's something that is in wide and extensive use. Next slide, please. So we're going to show you a short video clip here of one of the dance studios that is using the product, and I will go back to the Thank you. So I've worked in aerosol technology for 25 plus years. I used to be head of respiratory care at Omron in Japan, and before that I was on the European Nebulizer Committee, which is all about drug delivery. And so there's very little that I don't know about aerosol and the effectiveness of aerosol, and use for air disinfection and lung therapy. So HOCl, because of its very nature, is extremely effective for the chain reaction that it has at diminishing the pathogens in the air. And we ran some studies, which I've just got the results back just today, where we claim a 30-second to a minute degradation of active pathogens as soon as you spray them with Nemesis. And the Glasgow study came back today that they saw from marking bacteria with fluorescence enzyme, they saw that within 3 seconds of the camera starting to run and spraying with Nemesis, that the cells that they'd sprayed had died. The rapid onset of the effect of HOCl on pathogens is staggering, and HOCl is 100 times more powerful than your average bleach. It reduces by 6 log the number of pathogens in the room. And to understand what that means going from 1 million active pathogens down to 1 in less than a minute. Next slide, please. So just to summarize, it is important, however, in addition to fogging, to spray those hotspots, because I can't reiterate more that it's down to human behavior. And if you're going to be passing through the same door, touching the same door multiple times over by multiple people, it's only got to have one person in that chain of the 20 or that go through the same door not to have washed their hands as well as you did, that they've then passed on to you what they left behind, especially if they've used a sticky alcohol-based or other types of hand gel to wash their hands, because pathogens tend to stick to it rather than being killed straight away. Next slide, please. So in summary, you want to look for something that's highly effective. You don't have to get all donned up in hazmat suits, that you can fog as well as use as a hand sanitizer, that isn't toxic because it's not registered COSH toxic product. If you have a look in your cupboard and have a look at what toxic warnings there are on the products you're currently using, you might find it's a bit of an eye-opener. So ultimately, this is potentially a solution for you to consider for allowing you to get your business back up and running, and yet being extremely responsible for the care and welfare and COVID safe for both your customers and your staff and yourselves, and to future protect your business. Thank you very much. I think that's the last slide, isn't it, Alex?
It is indeed. Thank you very much, Adrian. That's great. I'm going to stop the presentation from my end, and I'm going to hand over to Lee and Paul now at Camfil, who are going to run the presentation directly. Whenever you're ready, Lee.
Right. Let's hope this works. So, over to you, Paul.
Okay, afternoon everybody. Lee, can we have the next slide, please?
No, by looks of it. There we go.
There we go. Hey. Okay, afternoon everyone. Thank you to Alex and Adrian. Just to give you a bit of a history, I know one of our participants, Dale's, just commented that we're local to him. He's in a town not far away from Camfil in the UK, or Camfil's manufacturing plant in the UK. But for those of you who don't know us, Camflo are a leading manufacturer of clean air solutions, filtration and filtration units in hospitals, in industrial environments, in offices, in commercial, in gyms, in motor manufacturing, you name it. Generally, if you've been there, then there are Camflo filters in there. We were founded in 1963 and are still, in fact, owned by the same family in Stockholm, in Sweden, although we are a worldwide entity with 30 sites, manufacturing plants worldwide, and 6 R&D centres, and just short of 5,000 employees at this time. Next slide, please. So this was just to give you an idea of the type of environment or companies that you'll be familiar with that we supply to, be that filters or be that air cleaners or air purifiers or a combination of all. The NHS we're very heavily involved in, and we'll come on to that a little bit later. Coca-Cola, Britvic, obviously brand names that we all know. Heathrow Airport there, we supply to the majority of airports throughout the UK, again with filters of air handling units and mobile units as well. And perhaps more relevant to or linked to the sort of industries that you're in, we supply the BBC, ITV, the Royal Albert Hall, Channel 4, and more recently supplied a large number of mobile units to an arm of HBO Time Warner Film Studios in London, for exactly the reason that we're going to discuss here today. Next slide, Lee. And that's you, sir.
It is. So yeah, I'm Lee. I'm one of the sales guys for Camfil. I'm based down in the southeast, and I am a dance dad, which is why I've got involved with doing this. I mean, the whole purpose of us talking today is giving you the clean air, so as you can get your studios up and running, whether you own it or it's a hall that you rent out. Air quality is recorded in PM values. That's particulate matter. You may well hear on the news when they're talking about air quality about PM10 and PM2.5. They're the standards that everybody talks about, but we talk about PM1 as well, as this is the most harmful and can potentially get down into your lungs and through into your bloodstream. We'll just touch on this very briefly. This is to do with if you're lucky enough to have mechanical ventilation in your facilities. So that means an air handling unit or a fan in a box blowing air into your system. So it's bringing in fresh air. It should have filters, and the filters should be again classified and tested. The standard test is ISO 16890, and if you've got a fresh air supply, the minimum should be an EPM1 60% filter. That means it will filter out 60% of 1 micron and below. If it's got a recirculation system, then an EPM1 80% should be relevant. And this is all based on guidelines given by all the relevant associations and guidelines from BISA, CIBSE, Eurovent, even the World Health Organization reference this. But we want to at least understanding the size of the virus, really. I've already mentioned microns, that's 1,000th of a millimeter, but I always like to help visualize things. So a human hair is typically between 60 and 20 microns in diameter. Pollen, 10 to 40 microns. If you've got good eyesight, you should be able to see about 10 microns. So bacteria at 2.5, and a virus is below 1 micron, but typically between 1.2, 0.12 and 0.16 with a micron. So for that point of view, you need good filters because it's rather small. This is all sort of touching on similar things that we've already spoken about. Benefits of clean air, it's not just about removing viruses, pollen, allergies, asthma sufferers. You've got clean air around you. My daughter is a asthmatic, So having clean air around her makes a big difference. Things like blood pressure, lifespan, improved digestion are all benefits of having clean air around you. So that's why we at Canfield like to bang on about it. A good filter designed to filter out the virus is classified as a HEPA filter. This slide is a little bit messy, but it's all filters are tested to EN 1822 2019. That's the standard. And all filters are tested to the most penetrating particle size, which is typically 0.1 to 0.02 of a micron, exactly the size that a virus sits at. So when we're saying that a filter will remove 99.95% of anything of most penetrating particle size, it will capture and remove the virus. Filters should be tested and classified. There is lots of filters on the market which aren't tested every time. We've actually got a small video at the end of this to show how the difference that makes. And then back over to Paul to talk about the actual air purifiers.
So, as Lee said, we supply air filters to a massive variation of environments. For their air handling units, everybody's lucky enough to have mechanical ventilation in the building that they've got their dance studio in, for example. So the current government guidelines referring to 10 to 12 air changes per hour, if you have no mechanical ventilation, where do you go? Well, there are alternatives. Canfield have a range of mobile HEPA units rather than air purifiers or air cleaners. They're all designed around the same systems, as you can see here. Smaller units, floor standing units, desktop units, to larger 6 foot tall industrial units that you might see in a warehouse, Britvic or Coca-Cola, for example. Well, they all work on the same principle. They've all got the same filter media in them. They all have a pre-filter of one design or another, which will protect against larger particulate, the larger dust that generally we can see and we clean up each day. And behind that, tested and certified HEPA filters. Now, the question was asked on a webinar I was on yesterday, with so many air purifiers on the market since the launch of COVID, or it seems since the launch of the pandemic. Which air purifier do you choose, and how do you know you're choosing the right one? Well, ultimately, it comes down to what's inside the box. If you are certain that the manufacturer that you're dealing with or the reseller you're dealing with, that the filters are tested and certified, ask them for a copy of the test certificate. If they can't produce that, then it may add a question mark as to whether these filters are exactly what they say they are. There are a number of other filtration methods, mobile filtration methods appearing on the scene at the moment as well. But again, are they tested? Are the standards that they have to correlate to? Are they going to do the job that it says on the tin? And just on the back of that, before I forget, you'll find a lot of people HEPA bashing, for one word, to put it in one way, that HEPA filters can reduce particulate or remove particulate down to 0.3 of a micron and nothing more, which is not the case if the HEPA filters are tested and certified. As Lee pointed out before, we test the most penetrating particle size, MPPS, which tests between 0.1 and 0.2 microns. So that means our HEPA filters and the HEPA filters in these units are capable of 99.95% efficiency at 0.1 or 0.2 microns. So that's obviously the area where viruses sit as well. The reason that quite often you'll see publications with 0.3 of a micron is the test method, that takes place in the field can only measure 0.3 of a micron. So that's the lowest efficiency. Next slide, please, Lee. About all the units that we have available, the one that seems to be most prevalent to people in your industry and offices and so on, and has been the fastest mover this year, is this model, which is the City M. Standalone unit comprising of dual air intake, which is a patented design where you're drawing air through two opposing sides and through two weighty, in other words, a huge amount of filtration, H13 HEPAs, preceded by F7 molecular filters, and supplying air in a 360 directional below. The beauty of this unit is it comes into your environment, you plug it in, you switch it on, and that's all you need to do with it. You are effectively introducing H13 HEPA filtration in your environment without any kind of messy installation or expensive installation. Next slide, please. Just a little diagram to give you an idea of the effects of H13 HEPAs on particles that are smaller than 1 micron. So you can see the particles on the diagram here heading towards the filter, trapped in the filter, and the clean air supplied afterwards. And the particles below 1 micron are often vehicle emissions, bacteria, viruses, and so on. Next slide, please. Thank you. This is just a graphic that I wanted to put in to explain the filter in the CTM and how it differs from other filters in competitors' units. They are equipped with 40 to 50% more filter media than our nearest competitor, who obviously shall remain nameless, and also provides a good product. But we have a lot more filter media in there. The benefit of that is you're trapping a lot more particulate, and the filters will last longer, 1.5 to 2 times longer than the nearest thing in the market. Less energy costs. With the air being drawn in through 2 opposing sides and through 2 filters, you only get double the filtration than you will get in a standard air purifier. But you're reducing the pressure on the fan, and therefore the fan costs less to run. And one of these units, if you were to run it 24/7 over a course of a year, costs you no more than it will cost to leave a light bulb on for that time, for example. Next one, please. So in the past, we've been asked to prove that these systems are effective, and we have a way of measuring particulate with a laser monitor before and after the units are turned on. And this one, in fact, was one that I attended. It was on Battersea Park Road in London, heavily congested road, and it was a general office that wanted to improve their air quality long before we had COVID on the scene. So the method of that, or the methodology, is we'd go in, we'll set the particle counter running, we'll count the number of particles, then we turn the air purifier on, let it run for 10, 20 minutes and show the reduction in particles through the program that we have connected to the particle counter. And as you can see here, the spike at the top on the left, which is around about 940, 941, is 150 million microns at 0.3, particles, sorry, at 0.3 of a micron. And within 20 minutes, you're down below 10 million. And the longer you left it running, the more effective it being. In fact, in this case, the owner of the company was a little bit dubious about it and was a little bit dismissive, putting me on the back foot when I was there. But when he saw the evidence for himself of how quickly these units improve the air quality in the environment, he took 2 units straight away, and they've been happy with them. Next slide, please. So this video that we'll click on in a second will show you the difference between absolute HEPAs, a can-fill HEPA that's tested and certified and proven to work to 0.1 and 0.2 microns, and other HEPAs that are available on the market. You'll hear the terminology true HEPA bandied about. Obviously, you'll hear HEPAs talked about your vacuum cleaner and whatever it might be. We should have hopefully had some sound on here. So I'll talk through it. So that's the filter on the left is a filter out of a CTM that we just discussed, and the filter on the right is a replacement filter for a competitor. And this is a test smoke rig that we use to show how much filtrate or how much of the particulate each filter can trap. And as you can see, the absolute HEPA at the top, our HEPA there is let a tiny bit through. We'd be leading people astray if we said that wasn't the case, because they are 99.95% efficient. There's a small percentage of leakage that can happen. But nonetheless, more effective at trapping particulate and other things that are on the market, and we will put our names to that. Okay, next slide, please.
That's us done.
And we are through. Welcome for any questions. Thank you for listening.
Great, thank you very much all. If you want to start sharing your screen, Lee, that'd be great. Thank you to all of you for what's been very valuable information, I think. It's really now over to those of you that are present. The Q&A module is up and running. If you want to pop any questions in there, and then we can try and put those to our panelists here. So we've got the first one here, which is for Adrian, really. So in terms of Nemesis EH2O. So what's the advantage of EH2O compared with the hypochlorous acid generated from the effervescent sort of bleach tablets, which produce a solution to the government kind of recommended ppm?
Right, yeah. So this is in fact an issue that I'm addressing with the innovation government grant, because at the moment there is no standard for HOCL, and I've got a grant application in right now to establish a BSEN standard, because you can buy powder. I've got some in my lab at the moment, which is an import from Taiwan, which says on the packet, hypochlorous acid, add water. Well, it's not hypochlorous acid, because hypochlorous acid only exists at a 6.5 to 7 pH. It only exists as a aqueous solution. What you've actually got in that bag is sodium hypochlorite. Sodium hypochlorite plus water is the same situation as you have in your swimming pool, and it goes from sodium hypochlorite to hypochlorous acid through a transition phase, but it's unstable. So basically, hypochlorous acid has been around since the 1700s, but it was identified as what its actual chemical analysis was in the late 1800s, and its powerful biocidal capabilities have been known extremely well. It's only recently that being able to stabilize it and bottle it and sell it in a liquid form has come about, and that's only been licensed this year with the ECHA, which is why a lot of people have never heard of it before. But the idea of using hypochlorous acid as a powerful biocide has been around for many years, and many people, your swimming pool, when you go and swim in it, the way that they generate the hypochlorous acid that is killing the bacteria, viruses and funguses in your swimming pool is they have put tablets of sodium hypochlorite or another chlorite, available chlorine product in your pool. So there's a wide spectrum of how to get the benefits of hypochlorous acid. You can buy a kettle online from Amazon that you take table salt and you pour it into tap water and you turn on the kettle. In a few minutes, you'll have a kettle full of a mixture of sodium hypochlorite, H2O, HCOLL, and other ions. But how effective it is at killing bacteria and how safe it is very much a hit and miss, depending on how many ions there were in your water, because you have to have pure water or deionized water to be able to make a stable version of hypochlorous acid. So the difference between buying something like Nemesis, which is recognized that the manufacturers of Nemesis make the purest hypochlorous acid there is available anywhere in the world, not just in the UK, and all the other product that you can buy on the market, it comes down to its shelf life and its stability. At the moment, our product and the facility where we make our product is the only ECHA, European Chemicals Agency, registered stable product. All the other companies that make HOCL are yet to register their stability studies with the European authorities. So when you buy a product like ours, you're buying a surety, guaranteed quality that's has liability insurance and product liability insurance backing it up, and is registered with all the correct licenses. If you buy it from anybody else, you need to check that they've got the correct license. They are approved by the ECHA, and their product liability insurance therefore stands up. And making it at home from a kettle, you have none of that. And your parts per million is about 30 parts per million.
Excellent. Thank you very much. A quick one for either Lee or Paul probably makes sense. In terms of cubic meters for, I presume, the City M, which is probably the one that you show in the film, but I know you've got numerous units. What sort of cubic meterage is a unit able to sort of clean, I guess, would be my way of putting it, but that's probably a wrong term.
All the units that we have, even the big ones, are specified in meters squared for a estimated ceiling height. So it really depends on that ceiling height. If the ceiling height's no more than 3 meters, then you'll achieve 75 square meters from the City M. If it's higher than that, then we need to look at whether we need extra units to cover the higher space. For example, if it's in a church or something like that, where you're 10 meters, you may need 2 units or 3 units, depending on how big the floor space is. But generally, what we do is have a chat with individuals, talk to them about their environment. If need be, Lee or one of his colleagues around the country can pop in and have a look. And we'll always give the best advice on how many or how few units you'll get the best results from.
Excellent, thank you. I think this one is for you, Adrian. You mentioned, I think at the end of your presentation, that you need a scissor cut or wipe down, and it just needs a bit of clarity on what you mean by that. So obviously you fogged a space and you mentioned a scissor cut.
Yeah, so basically what that means is that as you're moving the biofilm that you've lifted from the area where you've decontaminated your surface, there's a misunderstanding with people in general cleaning practice that if you take a cloth, spray it with your bug killing capability, and then you continue to wipe over the same surface backwards and forwards, all you're doing is wiping it off, reapplying it, wiping it off, reapplying it. So you need to move your cloth in a motion in a single direction, and the direction that we recommend is you start at the center of your table or surface, you move to the left or to the right, make your U-turn, and then come back the way, a bit like mowing the lawn, going backwards and forwards in stripes, making a progress across the surface from the center to the outer edge of where you're trying to clean. Because if you just spray and wipe furiously, all you're doing is spreading the biofilm around.
Excellent. So on the back of that, I guess, and staying on the floor, but another question has come in, would I need to wash the floor if I'm fogging the space? So do I need to then do anything more to it?
No, so basically, assuming that you keep the dance hall relatively clear with one of these big scissor dust mop affairs, as long as you've done that relatively recently and you've picked up the dust, because you can only disinfect the surface that the aerosol comes into contact with. So if the floor is covered in dust or other detritus, you're not going to be able to pass that to be able to reach the surface. So we're assuming that the floor is relatively material free and fabric free, dust free. So once you've fogged, the amount of water that there is in the fog, it's a 40 micron size fog with a geometric standard deviation of only a few microns. So it's very tight monodispersant aerosol, and you get a good fair coverage. You want to be standing back a couple of meters from the plume as to where you're contacting. So if you point directly at the floor, you're going to make it wet. But if you, like she did, sweep it in arc-like coverage, then the only residue you're going to get is that within a couple of minutes, the water will have evaporated. You might see a tiny amount of glittery kind of salt residue on some surfaces, especially mirrors, but nothing that can't be wiped off or polished off.
Excellent, thank you. We're just getting a few in about Zuno, which sadly, as James from Zuno couldn't sort of join us on this webinar, I don't think any of us are kind of best placed to sort of answer. So if you have a question on Zuno, it's probably best to sort of pop that via the Zuno sort of web channels, and I'm sure they'll be sort of delighted to answer that for you. One probably for Lee, this has appeared a couple of times in terms of sort of prices for the City M. So as a solution, be able to give a rough sort of guide in terms of.
Yeah, certainly. We
Be careful, Lee.
Yes, I know. Yes, prices start at the £1,300 mark, but we can always look at different options. We can offer leasing as a solution as well. So if you need multiple units, we can help spread the costs that way.
Just to clarify on the leasing is for partnerships or limited companies only. It's a third-party finance company that we use. And on the kind of price that Lee's just mentioned, if you wanted to go ahead on the lease, you'd be looking at £14 or thereabouts per week plus VAT over 2 years, or just under £11 per week over 3 years plus VAT, of course.
Cool.
Sorry, Lee, for interrupting there.
That's all right.
Thank you very much. One for you, Adrian. Obviously, in your videos, people obviously wearing a face covering or a mask, depending how you want to sort of term it, when they were, I guess, fogging, sanitising the room. Are there any known sort of advantages or disadvantages in terms of accidental inhalation of hypochlorous acids? You know, when you're sort of fogging, are there any concerns around that?
So this is actually quite a difficult question to answer, because as my colleagues with the high particulate filter and the demonstration you saw there of the lung penetration P1 and the rest of it, my background is 25 years in aerosol drug delivery to the lungs. So my recommendation is with all cleaning products to keep out of the respirable fraction of aerosol for lung penetration. However, as I also mentioned in the presentation, one of the body's own mechanisms of macrophage and phagocytes in the lung for destroying pathogens in the lung, in the periphery of the lung as well, including the alveoli epithelium, it's to use hypochlorous acid. So there's a lot of the body itself making this product inside its own defense mechanism. However, before the COVID pandemic, we had just started a drugs trial with cystic fibrosis patients at inhaling hypochlorous acid. But that's now come to a halt because of everything that's gone on since, because everyone's busy using it as a disinfectant instead. In some regulatory authorities, such as Australia, the TGA treat our product as a drug. They treat it as an inhaled therapy. So your question is a very good one, and I can't answer it directly, because we market it as a disinfectant and we stay out of the lungs micron size, 40 microns plus. But we have had anecdotal evidence from customers that their sinusitis has cleared up since they've been fogging it, that their colds have gone, that their sore throats have gone, so on and so forth. But we can't make any claims whatsoever, because otherwise that puts us in the realms of the MHRA's control. But in other regulatory authorities, such as Australia, they're busy approving it as an inhaled therapy.
Oh, interesting. I have to buy 5 litres myself. Another one here from ladies. Just, I think you made a comment at some point in your presentation about anti-bac versus antiviral. I can't remember if that was you or Lee or Paul. But just whether you could just clarify, I guess, the basics of antiviral properties versus antibacterial properties. Do you want me to grab that one? Yeah.
Yes, definitely.
So anti-bac and antiviral, the mechanisms by which and all the different standards that there are some products that are effective against bacteria. There are other products that are effective against virus. There are some products that are effective against virus, spores, whether they're in the xylite phase or in their open phase, fungus, CJD. Something like Nemesis is effective against Creutzfeldt-Jakobsen's disease, like an active protein, spores from C. difficile, virus, bacteria, with an onset of between 3 seconds on bacteria and a minute on CJD. So it is one of the most powerful biocides there is available. If you're using an anti-bac wipe and you're trying to get rid of something that's a virus, and it doesn't say on that pack antiviral, and this is very much why Boots came to us in March of this year, and said, we've heard that your product is an antiviral rather than just anti-bac. And we said, yes, it is. And they then ordered truckloads of it to put through Boots and through their stores and online store, because there's a big difference between something that destroys virus, which is what COVID is, and bacteria, which is also out there, but it's not COVID.
Excellent. Thank you for that. Another one here, which I could probably just answer, but it says, is barefoot dancing possible if you have effectively used Nemesis, clean the space, etc. with that? And that's because in our risk assessments, we discourage at the moment barefoot work unless a space can sort of be sanitized. So from a health and safety perspective, as Adrian sort of said, once it's dried, once it's settled, once it's dried, then yes.
Yes, as long as it's dried.
Yeah, then that certainly works, doesn't it? Have you, just because there's quite a few dance teachers on here, got any experience of any kind of interaction with the Harlequin type dance floors that we use? So that's the kind of rubber floors. Do you know if it's perfectly fine to use on those, or?
So yeah, so hypochlorous acid is a very powerful oxidant. So the only things that it doesn't particularly like are reactive metals. So if you've got any magnesium, zinc, aluminium, these types of things, you don't want to be storing Nemesis in it or on it for an extended period of time. So if you've got aluminium finishings and furnishings, you want to wipe them down, otherwise they'll start to tarnish. They won't rust, or they won't change into anything toxic, but you'll notice, how aluminium can gray. It'll go a bit of a gray oxidized aluminium look, but it's not dangerous or anything. It just doesn't look particularly attractive, but it doesn't generate anything poisonous. And the reason it does that is because it's a very powerful oxidant, and which is how it kills the pathogens.
Excellent. We've probably got time for one more, and then I think we need to wrap up. And again, this might be open to any of you, but ultimately, where does steam cleaning sit in all of this? Is steam cleaning still an effective form of?
Yeah. Do you want me to grab that one? Yeah. Okay. So steam cleaning is effective if you have real wood floors. You want to be careful about using steam cleaning, because the amount of unless you've got special seal finishes on the floor, you're going to find the effect that it has on your floor could cause your floor to become active and move because of the amount of moisture that it's taking up. But steam cleaning is effective for getting rid of COVID. But steam cleaning won't do much for your soft furnishings. I don't know if you're going to steam clean the walls and all of the fittings. So if you've not got any fittings or mats or anything of that nature, steam cleaning is going to be effective. But steam cleaning will take you a very extensive amount of time passing over each area with a long enough duration to be able to do the job.
Excellent. Thank you for that. I think we probably need to wrap up there.
Just one quick one. I did notice somebody had asked about whether our units cool. The answer to that is no. They don't cool. They'd have the same effect as an ordinary fan would, in the sense of the air movement will help generate a breeze, but it's a very low breeze. So I just wanted to just cover that one. That was all.
Yeah, there's a couple of questions that were raised. So first of all, I wanted to say to both Paul and Lee that the market in Asia for air disinfection filtration units is absolutely enormous. I used to live and work in Japan, and I was head of respiratory care at Omron in Japan, which is one of the biggest Japanese companies in this space. And it is actually as common as anything to have a home air filtration unit. Everyone has one. I mean, you go down to your local equivalent of PC World, and they sell air filtration systems,
Yeah.
and
Yeah.
they're run of the mill. And
Yeah.
my wife is Japanese, living here in Europe with us. She's astonished that that they're not more widely used, because she says the air quality here is just simply appalling.
Yeah. But
I just address one other issue that came up a couple of times in questions. The WHO have been asked about the business of fogging with hypochlorous acid, and they've recommended, as have the Japanese government, not to do it. And the reason they've done that is because in Asia, hypochlorous acid is so extensively used that every household has a hypochlorous acid machine, which they call electric water, in the same way as we have filtered water or softened water plumbed into our kitchen sinks. That is the system that they use all across Asia. But it's slightly different, because what they do is they take tap water and they just add, like you do with your water softener, they add blocks of sodium chloride, and then you turn on the tap and you get electric water coming out of the tap. Unfortunately, though, very much similar to the water filter systems we have here, unless they're maintained correctly and properly, the quality of the product that you get coming out. So what the Japanese Department of Health and the WHO have said is, look, there's such a wide variety of what people call HOCl out there, and some of it's at 500 or 1,000 or even 2,000 parts per million, which is not a safe thing to be fogging. Then we'd rather you didn't do it at all. So our product is a stable, guaranteed product at 135 parts per million in a pure water hypochlorous acid only, without any other ions in it, and it's stable for 12 months, is perfectly safe to fog. I wouldn't recommend people filling up their fogger with product that they've made at home out of the hypochlorous acid electrolyzer e-water machine that they've bought on eBay.
No, probably best. Excellent. Well, thank you to all of you, obviously on behalf of all the attendees. Just to clarify once again, this has been recorded, so it will be made available in the emails that you get post-webinar at the end. I will also include the contact details as well for Lee and Paul at Camphil, and obviously Adrian at Nemesis as well. If you're looking at having to bulk purchase, don't forget though, certainly with Nemesis you can buy it in Boots, but Lee and Paul will certainly be more than happy to obviously send someone out and have a look if you're interested in sort of the air purification. So thank you again to all three of you, and thank you again to all of you who are listening.
thank you.
Thank you.
Bye-bye.